Over the past few months, we have learned an enormous amount about how to prevent infections and save lives. But there is no single action that has made the difference. No testing alone, no contact tracing alone, not isolation, quarantine, hand hygiene, or physical distancing alone. The countries that have done well have done it all. This is the comprehensive approach that WHO has called for consistently. There is no silver bullet. There is no simple solution. There is no panacea. There is no one-size-fits-all approach. We all have lessons to learn from the pandemic. Every country and every organization must examine its response and learn from its experience. WHO is committed to transparency, accountability, and continuous improvement. For us, change is a constant. In fact, the existing independent accountability mechanisms are already in operation since the pandemic started. The Independent Oversight Advisory Committee has today published its first report on the pandemic, with several recommendations for both the Secretariat and Member States. In that spirit, we welcome the proposed resolution before this Assembly, which calls for a stepwise process of impartial, independent, and comprehensive evaluation. To be truly comprehensive, such an evaluation must encompass the entirety of the response by all actors in good faith. So, I will initiate an independent evaluation at the earliest appropriate moment to review experience gained and lessons learned, and to make recommendations to improve national and global pandemic preparedness and response. But one thing is abundantly clear: the world must never be the same. We do not need a review to tell us that we must all do everything in our power to ensure this never happens again. Whatever lessons there are to learn from this pandemic, the greatest failing would be to not learn from them and to leave the world in the same vulnerable state it was before. If there is anything positive to come from this pandemic, it must be a safer and more resilient world. This is not a new message. Reviews after SARS, the H1N1 pandemic, and the West African Ebola epidemic highlighted shortcomings in global health security and made numerous recommendations for countries to address those gaps. Some were implemented, others went unheeded. The SARS outbreak gave rise to the revision of the international health regulations in 2005. The H1N1 pandemic saw the creation of the Pandemic Influenza Preparedness Framework, and the Ebola outbreak of 2014 and 15 led to the establishment of the Pandemic Emergency Financing Facility, the WHO Emergencies Program, and the Independent Oversight Advisory Committee. The world doesn't need another plan, another system, another mechanism, another committee, or another organization. It needs to strengthen, implement, and finance the systems and organizations it has, including WHO. Many leaders who have spoken today raised two issues: implementing, supporting WHO, and financing. The world can no longer afford the short-term amnesia that has characterized its response to health security for too long. The time has come to weave together the disparate strands of global health security into an unbreakable chain, a comprehensive framework for epidemic and pandemic preparedness. The world does not lack the tools, the science, or the resources to make it safer from pandemics. What it has lacked is the sustained commitment to use the tools, the science, and the resources it has. That must change, and it must change today. Today, I'm calling on all nations to resolve that they will do everything it takes to ensure that the 2020 coronavirus pandemic is never repeated. I'm calling on all nations to invest in strengthening and implementing the many tools at our disposal, especially the global treaty that underpins global health security, the international health regulations. To be successful, we must all commit to mutual ownership and accountability. One way to do that, proposed by the Africa Group last year, is through a system of universal periodic review, in which countries agree to a regular and transparent review of each nation's preparedness. Since my election at this assembly 3 years ago, I have made a priority of transforming WHO into an organization that's agile and responsive, focused on outcomes and impact. 2 years ago, I presented, and this assembly approved, the cornerstone of our transformation, WHO's 13th General Program of Work. At its heart are the ambitious triple billion targets: 1 billion more people enjoying better health and well-being, 1 billion more people benefiting from universal health coverage, and 1 billion more people better protected from health emergencies. These are the targets that the world has set itself to achieve by 2023, to get on track and stay on track for the Sustainable Development Goals. The WHO results report launched today provides a comprehensive picture of what WHO, its member states, and partners have achieved in the past 2 years. On healthy populations, we have made important progress to improve the air people breathe, the food they eat, the water they drink, the roads they use, and the conditions in which they live and work are the most important, actually, in bringing health. Even before COVID-19, the world was off track for the SDGs. The pandemic threatens to set us back even further. It exploits and exacerbates existing gaps in gender equality, poverty, hunger, and more. Already we have seen the impact of the pandemic on immunization campaigns and many other essential health services. But the challenges we face cannot be an excuse to abandon hope of achieving the triple billion targets or the SDGs. On the contrary, they must serve as motivation to redouble our efforts and to work aggressively in pursuit of the healthier, safer, fairer world we all want. 40 years ago, the nations of the world came together under the banner of WHO to rid the world of smallpox. They showed that when solidarity triumphs over ideology, anything is possible. The COVID-19 pandemic is posing a similar threat, not just to human health, but to the human spirit. We have a long road ahead in our struggle against this virus. The pandemic has tested, strengthened, and strained the bonds of fellowship between nations, but it has not broken them. The COVID-19 pandemic is asking us two fundamental questions. What sort of world do we want? And what sort of WHO do we want?